Hi, I'm Mike Tierney of Data Not Distress. And in this FAQ, I'd like to answer the question, what is drug-resistant bacteria? And wouldn't viruses do exactly the same thing? In the early 1940s, the first purified antibiotic medicines based on penicillin were developed. By the mid-1940s, scientists were already warning that the overuse or non-therapeutic doses of antibiotic would lead to the emergence of drug-resistant bacteria, or bacteria that evolved ways to survive the antibiotics, thus rendering what could be life-saving medicine completely useless. Despite the warnings, in the 1950s, unscrupulous pharmaceutical companies began pushing farmers to give their livestock antibiotics preemptively in their feed. In the decades that followed, drug-resistant bacteria developed and moved throughout our food chain and into humans, who got it from the food they handled and ate, and thus infections then spread into hospitals, resulting in drug-resistant bacterial pneumonia becoming the leading cause of death in intensive care units to this day. Starting in 2012, after some 60 years of creating and spreading drug-resistant bacteria around the world, our medical industry was finally forced to give up on their guaranteed revenue stream with an endless series of the antibiotic of the week. After all, if your actually sick animal with a bacterial infection suddenly stopped responding to last week's antibiotic, well, that is because last week's antibiotic doesn't work anymore. So now you'll need this week's antibiotic. It would have gone on like this forever unless farmers themselves would realize that giving their animals antibiotics unnecessarily was leading to them having to continue to spend more and more on the next great antibiotic. But with the deaths of humans to drug-resistant bacteria soaring, our medical industry finally had to admit that their recommendations of preemptive antibiotics was a bad one. Science had to admit that it was wrong. The antibiotic skeptics of the 1940s were correct. And the profiteers who had seized control of science were responsible for countless human deaths to the drug-resistant bacteria that they themselves had developed with their wrong-headed policies and recommendations. So, why does drug-resistant bacteria develop? A simple fact that is true across every single type of organism on Earth. Each and every single one of us is born different from our parents. And it is not some aberration or accident. If you've heard of any type of organism today, be it a plant, animal, fungus, bacterium, or virus, it is due to one simple fact. Constant mutation creates variations that allow us to overcome and survive changes in our environment over time. Any organism that would fail to do this would immediately fall to extinction. As such, any surviving organism today is a variant, a mutation, an individual that is different from its parents in a way the world has never seen before, and thus possibly resistant to factors targeting the weaknesses of something that has been seen before. Those factors include predators and even antibiotics or other medicines. And so, viruses will absolutely follow the same progression as drug-resistant bacteria. Vaccines that create one identical antibody or a set of those antibodies across an entire population will simply introduce a filter around which any mutating airborne disease will instantly evolve to get around. The biggest difference between drug-resistant bacteria and drug-resistant viruses is that bacteria have had to evolve incredibly clever changes to protect their cellular mechanisms from the effects of the antibiotics. Airborne viruses have to do no such thing. They simply have to do what they do naturally, reproduce and naturally introduce variations in doing so every single time. Some of those variations will always get around any antibody that could stand in their way. An antibody is a simple pattern match of the DNA or RNA of the invading organism, and one variation is all that it would ever take to get around them. Coronavirus, for example, has 100 chances at doing so with every single cell that it infects. Introducing this exact same antibody across an entire animal population makes it incredibly trivial to successfully evade that one antibody throughout the entire population and render any vaccine utterly ineffective. This is why when Jonas Salk created a flu vaccine in his first job out of college in the 1940s, it did not stop the flu, because it will never be able to. This is why he never returned to working on such a useless thing and moved on to diseases for which it is actually possible to create effective vaccines. Today, a constantly changing flu vaccine is around 30% effective, and any attempts at an airborne disease vaccine will never be any different. But more ominously, today we are seeing exactly the same dynamics of drug-resistant bacteria playing out with COVID-19 vaccines. People who are vaccinated still get and spread COVID-19. Their bodies will have the antibodies that those vaccines were designed to produce across our entire animal population, and so their bodies will act as a filter, binding to and killing the exact variants that the vaccines were created to stop, and then spreading only variants that will get around the vaccines. This will then only necessitate new vaccines to stop the variants that the vaccinated are creating that get around the current vaccine. The only question is, what will be the effect of this mass creation of drug-resistant viruses? The drug-resistant bacteria that our medical industry created in livestock throughout the last half of the 20th century is now the biggest killer in our hospital ICUs. What the drug-resistant viruses we are creating through our current human experiment will ultimately do, no one can possibly know.